Within a week, all my IBS symptoms were gone. My massive runny nose, like I used to have to eat with a box of Kleenex, and that was gone.
Hi, I'm Anna Manuel, the co host of Transform Table Talk. And today we have a really interesting interview with Kayla, who dealt with long C, and that triggered so many health issues, some of them autoimmune. She was trying to get help from a special clinic that dealt with long haul and wasn't getting anywhere. In fact, was getting worse. And they just kept adding more and more medications onto Kayla's regimen, and it just wasn't helping until she found Dr. Maggie.
I'm Maggie, MD, functional medicine physician, and I can't wait for you to look at this case. She's a great case study. We're highlighting her symptoms related to POTS, mast cell activation, Raynauds, chronic pain, you name it. There is symptom after symptom after symptom as a result of the big C and long haul. So I can't wait for you to see this.
Kayla, please introduce yourself.
I'm Kayla. I am 34 years old. I live in Oregon. I'm an operating room nurse, so I love to help others and dedicated my life for that. And I love doing like hiking, paddleboarding, traveling, all the go, go, go fun, adventurous lifestyle.
A very active lifestyle and also interesting. You're another person that has gone through this program that's in the healthcare industry.
Yeah.
We've had so many people, and I know Dr. Maggie and I were actually just talking about this yesterday, thinking back on all of the people in healthcare that have gone through this program. And it's interesting how what you learn in this program, and I'm curious to hear, how did it compare to what you knew from your medical training?
A lot of it just filled in some of the gaps. Like we don't, in my medical training, we don't go over the vital importance of, gut health and nutrients and vitamin deficiencies and necessarily like the cause and effect. When you already have disorders, what medications do you use and
Yeah.
those paths versus like tackling root causes and at a young age.
Well, it's like we just learned what are the band-aids, right?
Hmm.
And that's what's causing problems. Just what are the band-aids? People don't realize medical professionals are just trained in what are the band-aids, like this end of it, right? It's like people thinking like paramedics. Paramedics just know when they come in to assess a situation. They can't fix what's causing the problem. There's not even anything long-term they can do. But what are the exact band-aid that's needed at this moment to stabilize this person so they can get to the ER? So
Hmm.
it's like medical professionals have a very specific set of skills, and that's in patching, Band-Aids, what is
Hmm.
the need to get this person to the next doctor or next provider, uh,
Mhm.
right? Not to solve what the problem is. That's not what we're taught how to do. That's just
Mhm.
not what medical training is about.
And I
Kayla,
work in the operating room, so I'm like very last step, of like we've already gone so far. Now we're here to save your life. And
Here are
yeah.
the tools.
Mhm.
right. And it's
Right.
very important. It's very important. But a band aid wasn't going to work for what you personally started dealing with. Why don't you tell us what's been going on with you medically?
Yeah, I took care of a patient at work who had long C and ended up getting symptoms within 5 days and was a pretty rough couple weeks. I started getting better and then I ended up in the hospital and got way worse. And ended up with long C, and just a whole slew of things came from that and triggered a bunch of things like nervous system disorders from POTS and tachycardia. I got mast cell activation syndrome, where I developed a massive gut infection that turned into leaky gut, developed a ton of food intolerances, foods I could eat before that now would wreaked havoc on my body with the mast cell. I just had eczema and hives all over my body. I got hand tremors, muscle spasms, COVID toes, anything from head to toe, you name it. I got it. Like the only thing that wasn't
TMJ,
affected was my
Raynauds. You
lungs.
had
Yeah,
TMJ, you had Raynauds, and
hmm.
how long did you have long haul for?
And just past my year mark
1
now.
year mark.
So
Yep,
over a year now.
yep.
It's been a very hard year.
And a lot of people don't even realize that the big C can actually trigger autoimmune issues. I mean, and that is exactly what happened for you. People think, oh, maybe I'm going to get autoimmunity because I have a genetic susceptibility or this trigger happens in my life. Well, guess what? C is a trigger, and it was the case for you, and your life completely spiraled, it sounded like. What
Yeah.
was it like dealing with all these issues? Were you able to continue working? What was going on with your life?
I haven't been able to do much of anything. I haven't been able to work. And, going from a very active lifestyle, like in 2021, I hiked over 500 miles. I climbed mountains, I paddleboarded, and I worked 12-hour shifts. So I was very active and healthy. I lived independently. And this last year, I haven't been able to even live on my own. I've had to move in with my parents, and they've had to take care of both households, mine and theirs. It's been a struggle just to survive and just to be able to like take a shower or brush my teeth or wash my face. There were most days where I would wash my face and my heart rate would go up to the 180s.
Mm.
Just the
Yeah.
toll on my heart and my body, and it would wipe me out. I was basically a horizontal pile of mush on the couch for most of this year.
So I'm just gonna put something medical out here that there's a truth bomb here that I really want to bring up to people, which is that if you have an underlying autoimmune disease of some type before you get the big C, typically what I've seen on this other end, working with tons of people with autoimmune issues, is that all those issues tend to flare and get worse. But what we're seeing is people who don't even have a diagnosis of autoimmunity get the big C, or they may get the long haul, and suddenly new diagnoses and new symptoms come up all over the place. And it's so funny that we're calling things like toes, we're calling things like the brain fog or this or that. Like we have names for these things, right? But what people don't realize is that the C virus actually can really alter the immune system and how it responds. So why are some viruses stronger than the other is that it has a capacity to actually cause our own immune system not to fight it off. It can evade our immune system. At the same time, it irritates the hell out of the immune system, which causes it to then start hyperreacting to anything that it liked to attack in the first place. So if you are already, let's say, rheumatoid arthritis, autoimmune attack against your joint area, you're going to get worse of that attack because of an irritated immune system. But let's say you didn't even know you had rheumatoid arthritis. Let's say you didn't even know you had Raynauds, which is attack against the arteries. Suddenly you have long haul, and suddenly you're like, my fingers and toes are turning white and they hurt. And they give it a name that's related with the big C, but really it's Raynauds, which is an autoimmune attack against the arteries in the toes or in the hands, causing them to constrict, causing pain. FYI,
Yeah.
newsflash. So there's a huge link with post C symptoms or long haul with autoimmunity.
Thank you for clarifying that. And I think that's going to be so helpful for so many people watching. So, Kayla, when you're describing to us all of these issues, I mean, not even be able to get up and wash your face without your heart racing, and you're having to move back in with your parents, and your life sounds like it came to a standstill. I'm curious to hear from an emotional standpoint, what was that like for you?
It was really hard. I mean, on the worst days, I needed help to even stand. I couldn't lift my own arms up. And, when you're used to being independent and giving and dedicating your life to helping others, to then like being so dependent on others, and not only dependent on them, but wondering what's going to happen. Like, I had so many medical providers tell me, we don't know if this is your new normal, if you're going to get better, if this is the rest of your life. And trying to stay positive and have that mindset when your doctors are telling you you're not going to get better and this is the best you're ever going to get.
I like to be the opposite of that. Like when someone comes into our program to say, is there anything you can do for long haul? Is there anything you can do for this big
Mhm.
season? Anything you can do with all the other symptoms that has come up with? My answer is, of course I can, right? Of course you're going to get better. But I understand it because a lot of doctors in the realm of experience, they don't see people getting better with these symptoms. They
Mhm.
see people just getting worse. They don't know. But it's the opposite of the experience we have in our program. I mean, Kayla, I'm just going to ask you this question. I mean, tell everybody, first of all, where are you at right now?
Finally got answers and I'm seeing improvements. And my doctors no longer say, we don't know if you're going to get better, but we don't know when you're going to get better, but you are getting better. And they're seeing it and celebrating right along with me now and using that excitement to encourage their other patients at the Long C Clinic.
Well,
Well,
and let's be specific. Yeah. Tell us specifically what's getting better.
I can actually get ready by myself every day. And that's like, that alone is huge. Being able to shower every day, and I can, wash my face, brush my teeth. I can now make breakfast on my own and lunch and do my snacks. I can even do some dishes and not having to sit and rest between every single small activity.
is that the fatigue or is that the dysautonomia with the blood pressure switches? How's that?
The blood pressure I've actually done a lot better on. It's stabilized basically week 2 in the program,
Two
and
weeks.
Great.
2 weeks.
Two.
You dealt
And
with
I
it for
was
a year.
able to wean off of my fludrocortisone, which I was taking to drastically increase my
Two.
blood pressure.
Just two.
And my body hated that medication, so the idea of coming off of it was just huge. So no more passing out, no more losing my vision. So much better.
Imagine trying to work as an ER nurse, passing out and losing your vision. You're like, I'm done with that. But then you get these huge mast cell issues that's come up,
Yeah.
allergy issues. You got
Mhm.
insomnia, Raynauds, TMJ. What has
Mhm.
happened with some of these symptoms?
Big improvements. I actually came off of my cromolyn that I was taking for mast cell, which I had to take before I could even eat because the symptoms were so bad and they were instant. I've come off of that by figuring out what food intolerance I could actually do. I tried so many different diets, including low FODMAP, trying to do elimination diets and couldn't figure it out. Got my food mapping back, and oh, there were so many foods up there. So that's how I found out I had like the leaky gut syndrome and working on gut health, and I can eat now.
Well,
Like
I think
knowing what foods to avoid, I can manage my symptoms and
the
bring
key
more
is
nutrient
I think
density.
a lot of doctors don't know this, but COVID actually infects the gut.
Mm.
This is why there's so many gut symptoms when people get the big C. And because it's like, imagine like a super virus, it not infects the gut in a way that can actually destroy some of the cells in the lining of the gut. That's why some people get diarrhea, chronic nausea, even constipation. But leaky gut is just basically severe infection in the gut, causing some of these cells to be damaged so that the lining of the gut, between the gut and the blood wall, blood vessel behind it, is disrupted. So then a lot of these foods can start coming into the blood that doesn't belong there, and then it raises a lot of allergic reactions when you normally that stuff would never be in your blood. The food mapping process, it can be, some people get overwhelmed or confused by it. For me, I'm like, that's fine. It's just a big C. We can deal with this. I know what's real. I know what are some of the ones that we don't have to worry about. So being able to focus on a list of those things with clarity, I think is crucial for people dealing with big C or chronic IBS, ulcerative colitis or Crohn's, or example. So there is a list of things, but the thing is, how quickly after removing the list of things did you notice a difference?
Pretty instantly. Like within a week, all my IBS symptoms were gone. My massive runny nose, like I used to have to eat with a box of Kleenex, and that was gone. And yeah,
1
my
week.
energy actually jumped from 0 to 5% up to about 30 as
What
well.
did?
So
What did?
my energy.
Energy. That's
Wow.
awesome. Yeah.
Yeah.
And then
Mhm.
also, this is something that people don't necessarily think can reverse, but what happened to your Raynauds?
It's
Mm.
pretty much gone. Yeah.
It's gone.
Mhm. Yeah. Which is great. I don't have ice cold hands and feet all the time, and I don't have to combat between the COVID dose and the Raynauds. And
God, I'd love to know how many people out there that are listening right now have Raynaud's or know somebody with Raynaud's. And if they do, I want them to type in chat because this is a solvable problem. This is like within 2 months, your Raynaud's is gone.
yeah,
Yeah.
so much more comfortable.
These are huge results, but the question is like, what do you think people want to know? Like, is this a miracle pill that she did? Because you were in a long haul clinic that
Yeah.
was focused on this and they couldn't solve this problem. You come to this program within the first 2 weeks, your POTS is gone. Within a couple of weeks, your mast cell, you're like starting to get off all your cromolyn for your mast cell. Raynaud's is gone. Like this is unheard of results in any sort of clinical setting. So
Mhm.
what do you think you did that was different here? What did you learn that was different that really caused this to happen?
Definitely learned a lot about cause and effect. Like at the beginning of the program, you had mentioned that this is like having a master's degree in your specific body, and every
It is.
body responds to things so differently. And with the Long C clinic, they were fixing me with more and more medications. So through your program, I have now come off of 7 medications,
Wow.
which also makes my body feel so much better. But learning how to tackle root causes with nutrient density and food mapping and balancing hormones and getting all these testings done. Also found out I was extremely nutrient deficient across the board
Because,
because of long C and the gut.
but even more than
I
that,
wasn't absorbing anything because there was just this massive infection in my gut.
but long C has a huge impact on your digestion.
Yeah.
That's the thing. Digestion,
Mhm.
I always keep telling everybody is king. It's king to any chronic disease. Like,
Mhm.
how big of a deal was digestion for you?
It was huge. Like I already had some issues, and then the Long C clinic put me on Pepsid, which
Hmm.
you need. You need your stomach acid, and that's when I got the mast cell, and it just flared up like crazy.
Because you need stomach acid to break down the
Mhm.
allergens in your food. The moment you give someone an antacid, Pepcid, Prilosec, whatever, Nexium, they're gonna kill me for saying this, you are decreasing the acid that breaks down the allergens in your food. Boom, all your allergies, mast cell histamine intolerance
Mhm.
goes through the roof. You heard it here first.
It's so true. I had that same experience when they put me on PPIs. My food allergies skyrocketed. So I'm another case study for exactly what Dr. Maggie's talking about. And nobody wants to deal with that. You don't want to add more and more problems on top of things that are trying to get fixed. Again, we're going back to band-aids. And that's all it sounds like you were getting from the care, really. You were dealing with this for a year and not getting anywhere. And then thankfully you found the Transform program and immediately started to see results. So I'm curious, how did you find the program and what were your first thoughts about joining this? Were you hesitant?
One of my friends who also has long C, her and I connected in August because we had long C. And she was telling me about this program because her stepmom had done it for Lyme disease and was bedridden for like, I think 3 years.
Heidi,
And yeah, Heidi.
I didn't know you guys were friends.
We have a mutual friend, and he was like, "Hey, you both have long COVID. You guys should meet." So that's how we met and connected. And yeah, her stepmom Kathy did the program, and
Yep.
so she was telling me about it. I'm like, "Let's do it!" Like we
And so then you guys did it together.
we did it. We were in the same week in the
We
same
were in the
pod,
same
so
pod,
we
same
got
program.
to keep cheering each other on every
I
week.
didn't even
And
know that. We probably should have had them both on this interview. We should have had a twinsies interview here.
I know, because you guys have had equally fantastic results. Now you get to cheer on your friend too, who's also
Mhm.
improving and recovering just right alongside you, which is really the case of what happens. Maybe you can speak to
Mhm.
this as you're going through the program. You're not super, super special when it comes to your recovery. What did you see as you went through this program with others about what was happening with their health?
Everyone was seeing drastic improvements, and there was even one in my pod who feels 100% better. Like everything she went in with the program she'd been dealing with for a decade or more, and she's doing great. Like just tackling these root causes is life changing, not only for those of us that go through the program, but also those we know. Like we can help spouses or kids or family friends and stop it before it gets even worse.
Doesn't it make you think about your medical training really differently?
Absolutely.
I've worked as a waitress, just so you know, for about 10 years, I've worked as a waitress. And it was like when you're a waitress, you like learn how to take orders. And with that particular order, you're going to get this particular dish. It,
Mhm.
like there's like an algorithm to everything, right? Yeah.
Uh-huh.
It's without this, without that, without this, then is this dish. You push that button, like whatever, right? But it's like people don't realize how we became almost like dispensing technicians or just
Mhm.
diagnostic test orderers, but really not really even looking at the whole thing. Like, okay, we got a digestion problem here. We probably shouldn't be prescribing Prilosec, which is going to cause her to get a mast cell activation disorder. And that's going to cause her
Mhm.
not to absorb all her food and nutrients. It's going to cause her to have POTS and blood pressure problems and dizziness. And it's going to cause her to then have blood flow problems, which is going to cause the Raynauds.
All the cause and effect from
Boom.
one thing. Yeah.
You guys hear that? I just went right there. We're taught none of that in medical school, and nobody is teaching patients that right now. Nobody's teaching that right now. Doctors or patients this. I love being able to teach this.
Invaluable. And Kayla, did you officially have to stop working for a time because of your health issues?
I have been off work for the last year.
Okay. What are your plans going forward now?
Well, again, like what I was talking with my doctors, they're no longer saying you won't be able to return to work. It's a matter of when, and
Oh yeah.
slowly increasing that stamina, not only physically but mentally with the brain fog and balancing it with the post exertional malaise and building that tolerance back up. So, but I will return and mindset, yes.
Yeah.
Feel it. The body follows the mind.
Uh-huh,
The body
exactly.
follows the mind. Has to happen in the mind first, and then the body will follow. I
Mhm.
promise you.
Yeah, so hanging on to that hope and having that mindset of abundance rather than scarcity is huge.
Well,
It
it's going to happen.
I'm
Yeah.
curious to hear what was the mindset portion of this program like for you and how impactful was it?
It was really impactful. Like I had already done a ton of work on mindset because I know how awful that can be and how vital it is to stay in a positive mindset. But there was a ton. Like every week we worked on mindset with our group and our pods and also some of the training modules and just breathing life into our situations is so vital and to have that support and encouragement, especially in our season of life where it's so isolating. Like some friends disappear and you can't live the normal active lifestyle and be independent. So having that mindset and holding everything with open hands is just so powerful.
And what was your very favorite part about the Transform program?
Ooh, just one?
You can pick more than
I
one.
would say definitely getting answers.
Mhm.
I kept asking my doctors, to do more blood tests for vitamin and nutrient deficiencies with all my gut issues. I kept asking to get my hormones tested because I had read research articles on that. And with some of my symptoms, I knew my hormones were messed up. And they kept saying, well, we used to test people and they were fine. So therefore,
Mhm.
you will be fine and we won't test you. And but
So
I knew, like,
frustrating.
in my gut, like, these were issues, and yeah, and so just finally having answers and feeling seen and heard, and it's just a game changer.
And people want to know, what is it like to work with Dr. Maggie? When you're watching these videos, you wonder, how much do you really get to interact with Dr. Maggie and what is she like? And so I'm curious to hear from your perspective. How was that?
I love the amount of presence in this program. Before I started it, I looked at the cost and didn't really understand it, but then I signed up for it, and the amount of materials you get and the amount of time with Dr. Maggie and with the nutritionist as well, Allie. I mean, you work with Dr. Maggie 4 hours a week, where you work with nutritionist 2 hours a week, your pod every week, and then it's hundreds of hours of videos that you have access to. So it really is like having a master's degree for your body.
Right.
And it's just, yeah, you can't put a price tag on that.
Yeah, that's what I was going to ask you because you mentioned you looked at the cost and did it give you a moment to go,
Mhm.
whoa, I don't know if this is something that I can afford to do?
It did, yeah. Like I spent my emergency fund basically on it, which adds some anxiety to it and everything. But knowing what you get out of the program and to finally be getting answers was just so worth it.
And you mentioned, okay, you're working with Dr. Maggie 4 hours every week. When else are you working with a doctor that intensively? I mean, you were even at a special clinic for the long C, and
Mhm.
were you getting anywhere near that kind of time and attention?
No, you get about 15 minutes with each of the doctors and some with physical therapy. And that's about it. And that's once a month. So versus Maggie's 4 hours every week. And you can ask your questions, you can submit your lab results and get wonderful guidance.
Yeah. So you're telling me that now looking back, you feel very differently about
Mhm.
the cost versus the worth.
Absolutely. Yeah. 100% recommend it.
Okay. Well, and talk about that. Who do you recommend this for? You didn't come into this program initially with a classic, oh, I came in with, rheumatoid arthritis and autoimmune disease. You had other
Mhm.
chronic issues going on with your health that we now know led to autoimmune type issues. But who would you recommend this program for?
Honestly, anyone. We all have some sort of issue and it's so beneficial. But yeah, whether you have an autoimmune disorder or a chronic illness, or even if you deal with eczema or chronic pain, like my chronic pain has drastically improved, and I didn't even come into the program for my pain. And
And
that's been a pleasant surprise.
because you had chronic pain from a previous accident.
Yeah, I had a really bad car accident in 2018 and it was awful. Like I had a concussion, dislocated my left shoulder, my right clavicle, fractured my neck, messed up my whole spine. Like it was brutal. And being able to do things in the program drastically changed that. And my back and neck pain, I can, as long as I do the melt sessions every day, my pain's gone. I weaned off my migraine meds and my headache levels lower.
It
So
to me,
that's
it is
been
shocking to hear that you weaned off 7 medications. That's a
that's
lot of
been the
medication.
program, yeah.
In 2 months, you were able to do that. I mean, people
Oh,
dream about things like that, and granted, that's not the end goal here when you're starting this program for everybody. It's, there's a time and a place for medication, and if it's working for you, great. But if you can get off of them and function better than how you were functioning on them, I mean, that's the dream.
absolutely. Yeah.
So okay, well, what else did we not touch on that you wanna tell us about?
I don't think I mentioned that, like, I've been healing my gut, like, all my skin issues are completely gone. I don't have any eczema or hives or itchy areas on my skin, and that was like head to toe. It was terrible.
And
My melasma's even all gone as I balance my hormones, and
what did you learn about your hormones?
that I was in stage 2 adrenal fatigue, so another piece of the puzzle for the extreme fatigue and weakness from long C. And
Mhm.
I also got a hormone imbalance with estrogen dominance.
And you got very clear direction of how to work to address that. And that's one of the last things that is tackled in the program. So that's going to continue to even get better and better. But it sounds like already, I can tell just by talking to you that extreme fatigue, as you mentioned, is gone.
Mhm.
You are on your path to correcting these issues that doctors couldn't give you an answer for before, to say maybe this is going to just be life. This is going to be the way that life is. And you're a young woman, and that is
Mhm.
unacceptable. I'm curious, how has this impacted your parents? Because it sounds like all of your health issues really impacted their life in an extreme way. You're living with them again, they're doing all of
Mhm.
these things for you. So, what's it been like for your parents?
Yeah, I've been extremely fortunate for them, and they're saints. Like they've just been so helpful. And I'm very fortunate as well that they own their own business. So like my mom didn't have to quit her job or anything to be able to help me, thank goodness. But she's been having to drive me to all my appointments, run my errands, be there to take care of me and do meals and laundry and cooking, all the things, and it's just that I've been so dependent on them, as a 34-year-old adult. So I've just been so grateful for them. So now as I'm recovering, they're not so worried about me anymore. They're not wondering if I'm going to die or if I'm going to survive the night and everything. So their stress level is way down. And my mom's able to, go run errands without worrying that I can't stand up on my own. And no, she's not able having to cook, like, my breakfast and my lunch, and I'm not so dependent on them.
What a relief. I mean, I hear you say it and you have such a bright and positive outlook, I can tell. But, when you say things like, they're not worried about me dying overnight anymore. I mean, that sounds to me like it was a real concern and something that must have been weighing just so heavily on your family who loves you and just wants the best for
Mhm.
you. And to take away that out of the equation, to get rid of that fear, that must be huge.
Yeah, absolutely. Very huge. Yeah, when your daughter tells you that you have long C and all these nervous system disorders that sent you into borderline heart failure, and they're so used to seeing me be active and bubbly and living life to the fullest, and to see me not be able to move was really hard on them.
Well, I know you made a dream board as part of this program, and I imagine that being active and hiking and doing all those things again is probably on your board.
Oh, yeah.
Yeah. And
I kept telling everyone in my pod, like, my board is so full because I'm just so excited to be able to get back to all the things and back to traveling and hiking and just living a life of abundance. And
Kayla, thank you. Dr. Maggie, is there anything else you wanted to add?
Thank you for sharing your journey with us. That was really huge. And it's going to inspire a lot of other people because just because you catch something or get the long haul doesn't mean, even in a long haul clinic, if you're not getting the results, it doesn't mean that that's the end, that's over, that there isn't the ability to have other tools and other ways of thinking about it that could turn this around within weeks. So you're living proof of that.
yeah, one day at a time and still improving. It's just a huge relief to finally have answers and to be able to make practical steps to continue on the road to healing.
Kayla, thank you so much.
Kayla is a really great example of how someone, once they have experienced the big C, and I taught in this how it actually can trigger a whole cascade of autoimmunity, gut infection, you name it. If you know anybody that's dealing with not even the big C, but they're dealing with POTS, Raynauds, mast cell activation, and they're not getting help. I mean, she was in a specialty clinic and prescribed 7+ medications and it wasn't helping. In fact, it was making her worse. So if you know anyone in that situation that could benefit from seeing this interview, make sure you tag their name in the comment section below because sharing is caring. I'm asking each of you to help raise awareness around Big C and autoimmunity in general. Go ahead and put their name in chat. That'd be in the comment section. That'd be really great. If you want to learn more about the program, make sure you click the link above or below this video to start a chat with our team. Thanks, everybody.